Now we're going to go to a dialogue between ourselves, questions and answers, on best way to deal with difficult relationships, part 9. All right, everybody. I gave you a bunch of periods there, points on dealing with difficult relationships. It's doable. I do it myself because the bottom line is to deal honorably with these relationships. I'd like to hear any comments or questions. Anything you have to say, go as deep as you want.
Hi, Doctor. It's Andrea.
Andrea. Great, Andrea. Glad to hear from you. So Andrea, please speak.
Yeah, I just wanted to say I really appreciated what you had to say about the living with difficult children. That it's really the positive reinforcement because it's really attention-seeking behavior that they're experiencing. And I like your points how it keeps
Keep going. Just speak above it.
Yeah, I just really enjoyed your point system. I think that's a really positive way to reinforce that.
Yes, very good point. The point system is vital. It's immediate reinforcement, immediate punishment, and also you have to use the countdown and be very specific. You don't say clean your room. You say move your shoes from here to there. You got to be very specific. You got to say how many points you're going to get, how many points you're going to lose. And when you take away points, you look for some way for them to give them points for doing something good. Yes, the point system with children, special needs and non-special needs, works beautifully. Ages 5 to 12 at least.
Yeah, it's great. And yeah, I could even use that with my 14-year-old, and I think that would work beautifully.
You just gotta have something. When you get 20 points, you get this. Whatever this is, it's got to be something they want. Yeah, very good. Yes, I'm glad you brought that up. That's so valuable.
Hey, Doctor?
Yes. Thank you, Andrea. Yes. Who's speaking?
You can see me.
I see you.
Oh, it's Anas.
Anas, good to see you, Anas.
Yes. Good to see you.
I don't know why this thing keeps... Yes, Anas.
Yeah, so I like she said, I really like the point system, and I was wondering, like, is that something like we could use for ourselves as well, like as a like to reward yourself, like?
Yeah, you could say,
like a self-discipline type of thing.
A lot of people give themselves a little treat after they've achieved something. It really works with children in terms of self-reinforcement that way. The achievement itself is often the reward. When I set a world record when I was 65, I bench pressed 365. 65 years ago, I drug-free. I didn't need to give myself a treat. I was so happy that I achieved my goal. I was high for days just on doing that, and I feel a lot of pride in my achievement. But I didn't need to give myself points or do anything. So I would say in terms of self-reinforcement, typically, maybe not always, but typically the achievement, the activity is its own reward, typically. Good question. Good question.
Thank you.
You're welcome. Anybody else have any comment or question?
This is Jose.
Who is that?
Yeah, this is Jose.
Oh, Jose. Good to see you, Jose.
I think what also kind of has to play in mind is that you have to be doing something that you enjoy to kind of, or at least challenges you to give yourself that type of satisfaction in what you're doing.
Well, yes.
You get that sense of pride that you were able to accomplish it.
That's it. You feel a sense of achievement. You achieved your goal. The sense of satisfaction may only last an hour, a couple of minutes, a few days. Achieving it, because I've been wanting to do it for so long, or when I set a world record in a power pull-up with 140 pounds hanging in a chain belt, and I was 70 years old, I really didn't enjoy it. I was tortured. I'm going, yeah, screaming. You're just pulling. It's not a pleasant thing. It's not pleasurable. At least those types of achievements. But afterwards, there was a lot of satisfaction. I felt great for, a high even for a day or two. But so sometimes we do things that are pleasurable, sometimes we're not. We set goals. Look, when I got my Ph.D., it was a very tough ordeal. I loved my studies, but it was a very stressful thing taking those exams. I didn't enjoy taking the exam. I got some good grades. I worked hard. It was not enjoyable, but the achievement itself was very meaningful. I would say this. The meaningfulness of what you're doing is a reward. If it can be pleasurable, that's great. It may not be pleasurable. Getting my PhD was the end of a type of suffering because it was really difficult. But I did really very, very much appreciate the knowledge that I had learned. Good points, though.
How many points would you have given yourself for the PhD?
What's that?
I was like, how many points would you give
How many
yourself
points
for
did
the
I give
PhD?
myself? I'll tell you what I gave myself. When I got my PhD, I was 28 years old. I retired. I'm 82, but I'm still 28. Yesterday, I was 28. That's when I got my PhD. So my psychological aging stopped at 28. That was my reward. And I sort of felt like I retired. It was an ordeal. That was my rewards. Anybody else have comments or questions? I'm very interested. And by the way, when everybody, Aaron, please speak.
So what happens, say you find yourself in a lot of difficult relationships, being family, children, or decisions that you've made in life, and they're coming down on you just because, like, I kind of feel like I'm the difficult person then.
Well, sometimes I'm talking to you about difficult relationships. Sometimes we're the difficult person. Very good point. But I would say, follow the thing, wishing them well. Most of the people that might be talking to you in a way that's not right or behaving towards you in a way that's not right, nothing personal. It's not about you. They probably do this to other people. And the other thing to realize is, I know you very well, Aaron. You are a really beautiful human being. But only God truly knows you, and only God could judge you truly. Do not expect other people to really understand you and appreciate you. It's probably not going to happen very often. And that's their loss. Because understand a beautiful person like you is a joy. And they're deprived of that joy. But what can you do? You can't force them to understand you, to understand your point of view. It's probably not going to happen. You got to wish them well, and say it's not about me, nothing personal. And sometimes we have to distance ourselves from some people, even though we may not want to. We have to distance ourselves for a while, maybe permanently, but at least for a while. What are your thoughts about what I just said to you?
I'm starting to distance, but I'm feeling the pain of that. And I feel like the more I succeed and the more I grow in life, certain people resent it. And then it's like, if they supposedly love you, why would they want that for you? I want them to succeed. I want them to be happy.
Well, let's put it this way. People get jealous, and your success can make them feel inferior and inadequate because they're not achieving anything in life. They might say, gee, I'm not moving ahead. Look what she's achieving. And then they feel jealous. They want to pull you down. Happens a lot. Even people you think were good friends might turn on you. That can happen. That's a statement on them. If they were honorable, they would wish you well and might say, hey, Aaron, I love you. I respect you. I am jealous of you. Believe me, I would like to be in your position. That would be an honest statement. Most people aren't mature enough to do that. And that's their loss. That's their loss.
If you don't mind for me to intersect,
sure.
To kind of let her know as well, like, because I've experienced it myself with businesses that I started, and family will be your biggest critics, and especially your closest family and friends. They will be your biggest critics and your biggest challenge to show them that you can do what you can do. You can also grow from that as well. Like, don't take it bad, don't take it personal. Just take it in.
Well, let me interject this.
Take it in stride.
You're getting choppy. Sometimes that's easier said than done, taking in stride. Some people, when you tell them you can't do something, then they want to prove you wrong. I've known people, if you say to somebody you can't do it, they will do it. because they got to prove you wrong. But, taking it in stride, if you can, that's great. Often that's hard to do. Often that's not an easy thing to do.
It's my daughter.
Yeah.
I love her unconditionally, but she's not on board with where I'm going, and I'm doing it for me and my growth. And I wish I could have been the parent for her when she was younger, the person I am now, because I was a teenage mom. So for me, it's like who I am now could have been a better parent.
You know what? People who knew us when we were younger still think we're that person.
Yeah.
And I'm not that woman anymore. I'm not that guy. I'm definitely not that guy. And I've told my children, I have 7 children, I've told them, these are the issues I was going through when I was younger. So I might have appeared this way, but it really came out of insecurities, came out of other things. And I'm not that guy. So after I explained that to them, I don't think it changed anything, but I at least told them. Yeah. They still, because if they see any little sign of what you were, they say, you didn't change. Look, you're still the same person. So, people, but we have to we want to learn from that and know people that we found difficult at different stages in our life, realizing that person may not be that person anymore. That has to do with an ex-husband, ex-wife. They might have been just miserable as a spouse. And maybe they've grown. It may not be quite that person. Not that we want to be with them anymore. We're done. But when I say, I hope that person's grown, and it may not be that woman anymore, that man anymore. We want to leave everybody the opportunity that we're not the same, and hopefully they're not the same. So we learn from that to be more open to other people changing. A very good point.
Thank you.
Very good point. Very good. But whatever you did wrong when you were younger, I know you, Aaron. You loved your child. You did your best for your child. And whatever any complaint that your daughter has, it should be in a context of gratitude for what you did and sacrifice. The problem that we have today, even if you go to most therapists, they explore, what did your mother do to you to make you like that? Instead of, what did your mother do for you? And let's look at the gratitude you have. Then let's look at your complaint, which is legitimate, but in the context of the gratitude and respect that you should have for your mom. And that's lacking, which I'm trying to bring that more into the profession. That's my hope. Somebody else.
I have it from my mom.
What's that?
I have it from my mom, so that's
there you go.
A good teacher.
There you go.
Thank you.
You're welcome. Somebody else, I heard somebody else starting to say something.
Doctor, hi.
Well, hi.
It's me, Iris. Hi. Well, about parenting and all that. So it's just a comment. So for everyone, I'm a new mom. I have a 3-month-old. But what you said with the point system, what you said prior to that is to, when you give a request, to be specific. So instead of clean your room, put your shoes away.
By the count of 3. By the count of 3. You don't leave it open-ended.
By the count to 3. But I think the precursor for success for the person that you're working with is that being specific. Because there's a lot of, I see at least, where parents get mad because they tell their children to do something. And it's so broad that when the child doesn't deliver, the parent gets upset and they think they're just, not listening.
Disrespectful, disobedient children. That's what they think. And
Right.
See, the thing is, that's not, if you even say to a child, a 5-year-old, 6-year-old, I want you to get that room cleaned. Well, they may, put away a couple of pens and think they've cleaned it, but you gotta say, move your shoes to here to there, count as 3. Yeah, but the general thing, they'll probably be if you give a general instruction, a parent will probably be disappointed and upset.
Right, yeah.
You're right, 100% right.
It actually reminds me of a story. I have a coworker who is working with a lady that's developmentally disabled but very high functioning. She had a boyfriend. She's an adult. She got pregnant, but her parents didn't let her keep it, so she had an abortion. So thereafter, they prescribed birth control to her, and they put the birth control next to her toothbrush so she could take it every morning. So she got pregnant again. And the parents were like, how did this happen? Haven't you been taking your birth control? So they asked her to show them what she's been doing. Well, she goes, brushes her teeth, takes the birth control, and instead of taking it like a pill, she would insert it in her vagina, because in her mind, that's how you get pregnant. So that's where the birth control goes.
Wow.
And it's a prime example of not being specific. She wanted to listen to her parents, did what she said, but
you know something that's
wasn't specific enough for her.
That really makes a lot of sense with somebody didn't know. But you know, they would say take that every day. It probably one thing to say take it in your mouth, but they could have asked every. Yeah, that would have been a tough one. Because if they said to every day you take your pills, she would have said yes. But yeah, so that one, I don't think anybody would think to say you take this pill in your mouth. I don't think anybody would have thought to say that unless they were in there watching. There's some things will get by. You know, put it where you take it. Make sure you take it every day. How many people would say put it in your mouth, not your vagina? Who would even think to say it? So yeah,
But
that's a tough one. That's a tough one. It's a good story.
It's a prime example of miscommunication.
Yeah.
And so before I get upset when I feel like someone's not listening, I always try and reiterate what I say, ask them to repeat it to me to make sure that there's no misunderstanding.
That's the way to do it. But in that case, she said, you got to take this pill every day. Okay, Mom, I'm going to take this pill every day. You still wouldn't have gotten, some will still get biased, but generally that works really well.
Yeah.
Repeating it back. Generally, that's a humorous one. 1 in a million. Good story. I remember that story. It's a good story. Thank you.
Hey, doctor, how are you?
Yes, who is speaking?
Kimberly.
Oh, Kimberly, Nurse Kimberly.
How are you, doctor?
Good. Tell me what you're thinking, Kimberly.
Well, okay, so obviously it's always been about relationships for me, but right now when they were talking about I don't know who was talking before about being a young mom and having issues with their daughter and stuff.
Yes, Aaron.
I was cutting in and out, so I didn't get the full story, but just to kind of have an idea, I just wanted to say that I feel like sometimes kids are always going to complain about every little thing. No parent is ever going to be perfect. And it's just one thing that I just wanted to say is for such a long time, because my mom had me when she was 17 years old. And hearing her say what could I have done to be a perfect mom? It reminds me of my mom, because I feel like I blamed my mom for such a long time for just stupid stuff that she just couldn't help it, because she was a kid bringing another kid into this world. And now that I'm older, it's just I regret so much, because I used to be so mean to my mom, cuss her out, call her names, do all this stuff.
You know, Kimberly, you become one of the sweetest, kindest person I know. But let me tell you something. It wasn't just you. The society we're in is anti-parent. It's not just you.
Yeah.
If you had been in a Middle Eastern nation, I guarantee you wouldn't have been cursing your parent out. Guarantee it.
Yeah.
This country has gone in that direction of anti-parent. Blame your parent for anything wrong in your life. It's really a disaster. Now, I'm talking, a normal parent doesn't deserve it. No parent is perfect, but the sacrifice, but I'm talking about a normal parent, not a parent that's abusing the child, sexually or physically or verbally. Normal parent.
Yeah.
They've made tremendous sacrifices, and most children do not have the gratitude. In the teen years, they get really angry, nasty, rebellious, and it's societal. It's a societal issue. It wasn't just you. Believe me, had you been in the Middle East at that stage in your life, you wouldn't have been cursing her out. But at least you've come to repent. You've come to recognize and have more gratitude towards your mother. And you turned out really well.
Thank you.
You're welcome, Kimberly.
Yeah, right now, my mom actually, we get along, and I try to make up for everything. So I do spoil her and do all this stuff. But it's just I feel like we're always going to complain about something until we get older and we realize what we did.
Who's going to always complain about something?
Kids nowadays.
Oh, yeah.
Everyone always
But
complains about
it's a
their
societal
parents,
issue.
And it's,
Yeah.
I feel like there's no perfect way to be a parent. Kids are always going to pick and choose, and I feel like parents are doing a wonderful job. It's just the kids takes them a lot longer for them to realize it.
Well, maybe as we taught in school, certainly therapists were doing, let's explore what your mother did for you. Let's explore what your father did for you. Let's get to see what they did for you. Now, once you explore that and you see the amazing amount of things that were done, then you say, okay, now let's see, what complaint, you have some issues, see how that ties into it. But let's keep in mind what an abundance you receive from them. See, because there's a loss of perspective. Yeah, my mother did this to me, my mother did that. That's a problem. Yeah, your mother did do that to you. It's legitimate. But look at all the good your mother did to you, including going the pain of childbirth and raising you and breastfeeding you and taking care of, carrying you for 9 months and you're vomiting, getting morning sickness, whatever. Oh, my goodness. We can never repay our parents. Never. So here's how it goes in our society. One orientation towards your parent, you did so much for me, I can never repay you. I'll be grateful forever. That's one orientation. I want to tell you another orientation, all right? This is true, this other one. I didn't ask to be born. You brought me into this world. You owe me. I didn't ask to be born. You brought me into this world. You owe me. It sounds crazy, but that's there as well. And that is really destructive. Every divine teacher, I don't care what religion it is, talk about respecting your parents. But the idea, I didn't ask to be born in this world. You brought me here. You owe me. Oh, my God. Oops. It's true. The child didn't ask to be born. But then to drag from there, you owe me. Wow. There's something very destructive and dishonorable about that orientation. Thank you for everything you said, Kimberly. Very good, as always.
Hey, doctor.
Who's speaking?
You're welcome. This is Viridiana.
Who's this?
Viridiana.
Oh, Viridiana. Yes, Viridiana.
Hi, how are you? So just going back to where removing toxic like family members and friends from your life, how do you deal with the fact that, okay, so when I had my 2 kids, I removed family members because just it wasn't good for my mental health, and I needed to be good for my kids and my husband, which that's the family that matters to me. So, I removed that family, and now that I'm pregnant again with my 3rd child, they try to come back in life, and I'm just such a people pleaser that I allow them to come back.
Who are we talking
and
about?
Unfortunately,
Viridiana? Who are we talking about?
Yeah.
Mother, brother, sister. Who are we talking about?
It's like my husband's family, like a good close cousin to their family.
Cousin, okay.
But, and I allow them to come back, and now it's like the same toxic traits are happening, and it's just like, it happened once, but why do it again?
Well, one, the person may have changed, so you gave them, the benefit of the doubt. Maybe they've changed. You see, they haven't changed. You're going to have to deal with the boundary in a way that is done as honorably as you can, where you say, look, the way you are this way, I get very upset when you're around, when you talk that way, or it creates a lot of chaos here. You need you to stay away, and not forever, but until that can change. If there's some way of giving that message, or giving it your husband's cousin, for him to give the message, it doesn't have to be forever, but if that changes, fine. But if it doesn't, we can't have it around here.
And it's just unfortunate because, my husband, he's the I don't care type of person. Like, he can cut someone up and he won't have to speak to them. But I'm more of a, I try to have family put together. And,
that's a good attitude.
Family is very important to me. So, but he thinks otherwise, so I'm always, getting hurt because of it. But now because I want to cut her off again, now I look like the bad one because why can't I just accept the way she is? Why can't I just accept her personality? And how do I I'm like, is it really my hormones, or how can I like not like? I just don't want negative people around me.
Well, there's no simple thing. You're gonna be seen as the, you know, the bad one or the harsh one, the rejecting one, and all you can do is do it as respectfully as you can. Look, with all due respect, I have to ask you to stay away. I have a problem with you. This way, I just have to ask you to stay away. I'm going to ask you a question. So you don't want to have that around your children, okay? Are you okay talking to that person on the phone, or you're not?
No, because there's always a negative comment as to like how I'm parenting, how I'm doing as a wife, how I'm doing as a person. So there's always something negative.
Yeah. So when they're giving you that negative feedback, do you feel they're doing it to tear you down, or because they care and they want you to improve? What do you feel is behind it?
At first, I thought it was like, oh, maybe, you know, I should work on this. Maybe, you know, my kids should do this better. At first, I did think it was, I'm like, okay, maybe it's a positive feedback, like for me to, what does it say, positive criticism? Yeah. But then now it's like, no. Now it's like every little detail that, per se, her sister's kids don't do the same thing. She don't judge. Like, it's just me who I feel like I'm getting.
Okay. Well, you know, I hear you. You don't like to do that. You don't like to push people out. You can listen. With all due respect, I always feel judged and put down by you when I have to ask you to stay away. With all due respect, I really can't handle having that kind of thing coming at me. So you have to stay away. So you say I can't handle. I mean, that's all you can do. I wish you well. I wish you well. I can't handle that. And then what you say to yourself when you need to distance yourself that way, I release you to your destiny and I wish you well. I release you to your destiny and I wish you well. That's the best way of ending any relationship. And it's sad that it has to come to that, but you know, this life goes quickly. You live to 120, let's say. You know, I'm 82 years old. Yesterday, honestly, I was 28. Like that. So life goes quickly. We're gone. When we see that person on the other side after we pass and they pass in 100 years from now, everything will be fine. But in this life, it looks like it's not going to happen. But in terms of eternity, you guys will be fine, but not here. It happens. It happens to all of us. And it's sad, but it happens. Yeah, I hear you. And I hear that it's hard on you. I respect that. I hear you.
Thank you.
And it's sad because the children lost out on having a relative and she lost out on having the children. Sad. But
yeah, because, I mean, her kids and my kids love each other, and it's unfortunate that, you know.
It's a loss. It's a loss.
Yeah.
All you can deal with it respectfully as you can. I'll see you on the other side. 100 years from now, we'll be fine. Earth is just it's not working out. And you never know. Maybe 20 years, things could work out.
Yeah, hopefully.
God willing. Very good. I'm really glad you brought that up, baby Deanna.
Dr. Nerenberg?
Yes, who's speaking?
Hi, this is Francesca. How are you?
Francesca, I thought it was you. I recognize your voice.
Yes. I missed the first part of what you were saying, but I'm going through something similar to that with my son's girlfriend. They just had a baby, and normally I like to keep people away from me that are like try to provoke me to anger. And she has been just the sweetest. She knows what I just recently been through, you know, losing my older son. And she was so sweet for the last 3 years. She just had a baby and she's turned into a monster. It's like she's almost trying to like bring a wedge between me and my son. Like she came over with the baby for the first time for the family to see the baby. She didn't want anybody to touch the baby. She was just making all these crazy rules, and I just couldn't understand it.
Well, some people,
you know, it was really, and my son and I, we are so close, and I know it's tearing him apart. You know, he has to, you know, go along with what she says, but she was making ridiculous demands of everyone.
Well, let's go to that. Number one, some of it might be she's a germaphobe, but one thing is, I don't, this is just, it's nothing personal, not about you. She's just very overly protective of the baby. But it doesn't mean you want to be around her. She was good to you all that time. Are you able to have a one-on-one conversation with her, or that's not doable?
Well, normally we were pretty good.
Are you able to call her now? Could you call her tonight or tomorrow, or you can't do that?
After the way she was acting over the last few days ago, she literally made my blood pressure high.
Okay, Francesca, let me tell you, I understand. You can either distance yourself, but let me tell you, she can put a wedge between you and your son. Definitely put a wedge between you and your grandchild. So if you want to have a relationship with your son, you want to have a relationship with your grandchild, you might just consider, I'm not saying you should, but you might want to consider reaching out, tell her how much you've appreciated her all these years, and have a positive connection, if you can. If you can, Francesca. That's the way to protect your relationship to your son and your grandchild. Otherwise, she can pull them both away from you, absolutely.
Yeah.
So I thought with me, I would get into thought, I really appreciate how you've been to me all these years. In fact, I would call and say, you've been so sweet to me all these years. I'm so grateful. I want you to know that I never forget how you've been towards me. I treasure that. And the baby's beautiful. I'm grateful that you brought a grandchild into my life. I'm so thankful for that. And see where it goes. And text me. Let me know how that goes. I know you feel hurt. I know you probably don't feel like doing it. I'm just saying it's something to consider.
Yeah. Okay. I'll try that.
Well, yeah. Otherwise,
I just know a drastic change. Like my daughter had a baby. I had two grandchildren back to back. My daughter had a baby, and he's 5 months. She was here through the whole ordeal. She held him. She helped out and everything. Now she just had a baby, and she doesn't want anybody to touch the baby.
You know what? One thing, we went through COVID. A lot of people, and that's coming back in different variants. So it could be some issue with that. I would go, I remember how you were with my other grandchild. You were beautiful. I would just talk about all the good things she's done and give her a lot of gratitude for it. And I can see how protective you are of the baby. That's great. It's wonderful you're so protective. I'm glad you're protecting your child, my grandchild. Thank you. If you can do that, that's the way. If you can, that's the way to go.
Yeah.
I'll tell you right now.
That sounds good.
And text me. I want to know how it goes.
Okay. Thank you. I'm going to try that.
Yeah. Good, Francesca. Always. Wow. Thank you, Francesca. By the way, you're the stars of this. When I talk to my patients on the apps, they're always so happy to hear from everybody. Say, yeah, so-and-so said this, so-and-so said that. It really helped me. I don't feel alone with it. It was good advice. You guys are the stars of this, not me. I'm just giving the format and the stimulus. But the things you're saying are making other people feel less alone, more connected, and they're grateful to be part of this community. Really grateful. Excellent.
Well, yeah, I appreciate this, because these are like things that happen to us on a day-to-day basis, and it's good to have a platform to even be able to express yourself and talk about these things, because I don't want to make any more bad decisions. I want to do things that's right, and I want to feel good about my decisions from this point on. So thank you.
Thank you so much, Francesca. I respect you and admire the person you are enormously.
Dr. Nerenberg, can I say something?
Please do, but please say who this is.
This is Maricruz.
Maricruz. Very good, Maricruz. Please.
Kind of going based on what Francesca said, it kind of like touched me only because 2 years ago during COVID, I had a baby, and I feel like I was her daughter-in-law in that situation where, with my family, not necessarily with my in-laws, but with my family, when I had the baby and they were trying to come over and see the baby, like I didn't really want anybody to hold the baby. I didn't want anybody to see the baby, like after, like if it wasn't at my house. Only because I have read so many stories where I feel like nowadays versus like days where my mom had kids and stuff, like you read so much stuff on the internet about, somebody kissing your baby and the baby getting, all of a sudden an infection and, getting really sick and stuff like that. And, it started as a parent. I feel like around that time it was COVID too. I started to get really freaked out, and I started to feel like, oh my God, like I really have to be very overprotective of my baby. And me and my mom have always shared a very, very close relationship. And when I had the baby, she ended up telling me like a couple months after, like that she actually was hurt because she felt like I didn't want her around the baby.
Okay, let me interject something. Firstly, a normal mother is very protective. They always worry about the baby. They look, is the baby breathing, checking the baby. That's normal stuff. Normal stuff. And that was COVID, where the country was shutting down. The world was shutting down. Everybody, we didn't know what was going on. We just heard all these deaths. The hospitals had these big trailers filled with dead bodies. It was none of it. What's going on here? So, and now there's still, I talk to my patients, are you afraid of COVID? A little bit medium amount. Some people are still terrified of it. So that's a factor that goes on with that. As it went with you, as Francesca's daughter-in-law has, could be very well, particularly that COVID thing. We've always had the flu and colds, but this COVID thing really changed people's perspective of life and death. It was like, if you get COVID, you're dead. People had that attitude. If I get COVID, I'm dead. Or if my baby has COVID, he's dead. Not necessarily true, but we all went through that. And it's normal, as you are. You're a normal mother, being very, 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 very protective. Absolutely. I'm not saying it's a good thing necessarily. Maybe it's an overkill on it, but it's normal.
Yeah,
I'm
but
glad
kind
you
of like
shared
what you were
that.
saying to her.
I'm glad you shared that because that could help widen the perspective about it. I'm really glad you shared that.
Well, yeah, the reason I'm sharing that is only because on what you told her about, can you call her and speak to her on it? Only because it took my mom months. And when she finally spoke up about it, like I actually broke down and I felt so hurt because I didn't think that that's how I was coming off. I really thought like I was like, she would understand. And like, that was me like just protecting the baby and, the baby's born. But after she spoke to me, I feel like I kind of backed off where I was like, all right, like, I don't want to come off like that especially to my mom. But I felt like if I was coming off like that to my own mom, how was I coming off to everybody else? So definitely her speaking to me made me realize that. And it helped me overall.
Well, one way a person can deal with it, I'm probably overprotective. I'm very worried about germs. Please forgive me. I'm not going to let anybody touch the baby. I ask your forgiveness. That's one way, but most people wouldn't think to say that. But please forgive me. I have to protect my baby only because there's too many unknowns. But I'm so happy you shared this because Francesca, maybe some other people are running into the same thing. Thank you. Anything else you want to add or say to that? Yes, who's speaking?
This is Viridiana once again.
Viridiana, please.
Just basically, sorry, I didn't catch the lady's name who she was speaking, but I agree with her. And then somebody did put on the chat about postpartum depression. And that is very true. I mean, I don't know her situation. Like, if it's your daughter,
Francesca's
first baby,
daughter-in-law,
Francesca's daughter-in-law, first baby. But I did get diagnosed with my son with postpartum depression. He's my firstborn, and I was the same way. I was very overprotective. COVID didn't happen at the moment, but I was still a protective mom. Like, you couldn't see my kid without, hand sanitizer, wash your hands. Like, I was really overreacting. And now I see it after, I was, diagnosed and I was able to go to therapy about it. I would not even shower without my kid inside the restroom. Even my husband was in the living room. It's just, when you're a first-time mom, and especially when you go through postpartum depression, it's just such a tough...
I see a lot of postpartum depression. 30% of my female patients are having postpartum depression.
And it's good that if she talks to her, just because my mother-in-law talked to me and I was being her daughter-in-law, I was that person, don't hug the baby, don't do this to the baby. And it's just like, it's sad because sometimes we don't realize that we're doing it and we're, affecting others and we're being rude to others.
What you're saying is going to be very helpful to Francesca, I'm sure. You're giving the other side of the story. Very, very beautiful, beautiful, beautiful.
So just talk to her. I would recommend for definitely talk to her. And if she is going through something like that, all she needs is the support for family, and definitely, it'll help her, and it'll be like an eye opening for sure.
Thank you so much for that input. So much. Well, it's been my pleasure, my privilege to be able to present to you the best way to deal with difficult relationships.